Malingering. I call them clever people who are looking for some gathering or some utilities in a self position. They are not ill and don't need medical attention, but are using a medical services for gathering or achieving a goal. By definition, malingering is characterized by the conscious production of signs and symptoms for an obvious gain: money, avoidance of work, free bed and broad, and etc. It's not a mental disorder. Risk factors more frequently encountered in men, in prisons, men, in factories, in military services. Differential diagnosis could be made with somatoform disorder and factitious disorder. So, malingering is the purposeful production of falsely and grossly exaggerated physical and or psychological symptoms with the goal of receiving a reward. This reward may include money and insurance settlement, drugs, release from incarceration, or the avoidance of punishment. Drugs, especially people who are dependent of opioids and are coming to the doctor and asking for prescribing opioids, and they are telling to the doctor that simple or non-steroidal anti-inflammatory drugs do not help to cover or to abolish pain. A malingerer may, for example, attempt to raise the temperature of a thermometer through heat from a lamplight, or alter a urine sample by adding some sand to it. Or, as I told you previously, tell the doctors that have so severe pain that is not covered by simple NSAIDs. Some cases of malingering are easy to detect. However, if the malingerer is more discreet, a clinician may have great difficulty gathering evidence for an accurate diagnosis. You should know very well this, that malingering is not psychiatric disorder. It is similar to but distinct from, like factitious disorder, in which an individual fakes symptoms without a concrete motive for reward. Malingering is also separate from somatic symptom disorder, in which a person experiences real psychological distress from imagined or exaggerated symptoms. Malingering can lead to abuse of a medical system with unnecessary tests being performed and time taken away from other patients. Symptoms most express subjective symptoms, tend to complain a lot and exaggerate its effect on their functioning and lives, preoccupied more with rewards rather than with alleviation of symptoms. Malingering can exist in a variety of intensities, from pure, in which all symptoms are falsified, to partial, in which symptoms are merely exaggerated. A patient may simulate symptoms of a specific disorder or deny the existence of a problem that may explain the symptoms they are experiencing. Malingering is not easy to detect because of a wide range of possible falsified or exaggerated symptoms, as well as the difficulty in gathering overt evidence. A thorough clinical evidence is crucial to understand whether a person is malingering or not. Does exist any treatment for it? As patient is not ill, there is no treatment, but you as a doctor should Pay attention for this patient and listen it. So allow the patient to save face but not confronting the patient, and by allowing the patient-physician relationship to work. If confronted, patient will become angry and more guarded and suspicious. Also, they can leave you as a specialist and come to another for gathering the desired goal. Thank you for your attention. Have a nice day and see you in the next video, guys.